benefits enrollment. No problem. We will be reviewing, as you may know, we worked with the Insurance Labor Management Committee over the course of the past year. This year was our formal RFP, or request for proposal, for your benefits. So we went out on all of your different benefits, and we chose to move to Health Partners for your medical and your dental, and then stay with your current disability and life insurance carrier, Minnesota Life and Madison. So what we'll do today is just run through all of your benefits, and we'd like to ask to hold questions until the end, and that way we can hopefully answer your questions as we go, and we'll be having a microphone because this is a recorded session. So again, just to let you know who will be presenting again, I am Sherry with NFP. I have Katie from Health Partners with me, as well as Leanna from Task. So they will be up here doing different presentations as we go. Just to highlight very briefly on your supplemental or your life and disability lines, your life insurance, there are basically no changes. Your voluntary life is going to stay with Minnesota Life, but what we did do is add portability to life insurance, which is if you were to terminate employment with Washington County, you could COBRA your life insurance, which means you can extend it at the group rates with the county. And then you have the opportunity to port it. And that is, in the past, you could convert it, and generally they're going to be higher rates. By being able to port it, you'll be able to port it to and have it at a more group rate, so it'll be a lower rate for you to continue that life insurance. On your disability insurance, again, that will stay with Madison Life, and your short-term disability, which is a voluntary plan, was at a maximum of $4,000 per month. We have moved that up to $5,000 per month. So if your salary is justified in which you can obtain $5,000 per month and you're currently at $4,000, you can automatically up that at open enrollment to $5,000 without any health history questions. And as always, if you're not at $4,000, you want to up it by $100, you can do that as well. On your long-term disability, which is an employer-paid benefit, we are changing the definition of the duration of the benefit. In the past, the definition was up to age 65, and as you all know, the Social Security age is getting older and older, so what we did was change the definition. Again, it's beneficial to employees to be Social Security normal retirement age rather than just age 65. All right, now we will go into the medical plan options. Katie from Health Partners will come up and talk more thoroughly about them. But I just wanted to kind of give you an overview of the process this year. Again, we sat with the Insurance Labor Management Committee. They were very diligent. We met about every 2 weeks throughout the course of the year, did a number of educational sessions, talking about the marketplace, what's going on in the marketplace, different plans, different options that are out there and so forth. And the group decided this year, again, through the formal RFP process, that Health Partners was the best fit, and we tried to mimic the 3 plans which are currently being offered through Health Partners. The first 2 plans being your copay plans at a tiered level of network, and Katie will talk about that, and then the third plan being the $900 deductible. But what we also did this year was add a 4th plan, which is a high deductible plan compatible with an HSA. So Katie's going to talk about the insurance plan on the high deductible plan as well, go into a little more detail, and then I'll come back up and talk about the HSA, or the health savings account feature. Essentially, this is a plan in which the premise of these type of plans is that it helps you to understand the cost of health care today, because it's certain regulations by the IRS mandate what type of plan you put in place. So you'll see that all services are subject to the deductible, which helps people become aware of the cost of care and shopping around for care. But the health savings account feature allows you to put away dollars to help pay for your cost of care and also save for the future. So again, we'll talk more about that. That's going to be through Wells Fargo after Katie goes through the insurance products.
All right, so as Sherry mentioned, my name is Katie and I'm with Health Partners. And as you can see, we are going to keep the $25 copay plan, $35 copay plan in place. These are both considered tiered networks, so we tier them based on our distinctions plan. For the Distinctions Network, you have the option of more than 950,000 doctors, and you also have over 6,000 hospitals in the network, and that includes all hospitals in Minnesota. And the way we base our providers on the Distinctions Network is we divide them into benefit level 1 and benefit level 2. We divide our providers based on quality and cost. So as you can see, you're going to have a better quality and with a lower cost for benefit level 1, a little bit less quality in benefit level 2 according to our research with a higher cost. And that is for the Distinctions Network. I won't go through the plan benefits in detail as you have the handouts that list the benefits. These are also available online. So as you can see, this is the $25 copay plan, the $35 copay plan, which we did not make any changes to these plans. The Open Access Network. So with the Open Access Network, you have the $900 deductible plan as well as the HSA plan. With this plan, you have the freedom to get the care and support you need. You have the choices to find a doctor wherever you live, work, or travel nationwide. We actually partner with a company called Cigna for when you're in Florida for a weekend on vacation. You would just call your Health Partners Member Services line and they would help you find a provider that contracts with Cigna. Again, we didn't make any changes to your Open Access 900 plan, so I won't go through these in detail. So here you will see the benefits of your $2,600 HSA plan. So a few things I want to note is this is an embedded deductible plan. So if you're on the family policy, your out-of-pocket max per person is $3,700. So the deductible would be $2,600 per person, even on the family policy. I also want to note that this plan includes a preventive drug list. So $12 for generic medications and $45 for preferred brand medications. And you can find the list of preventive medications that we cover under this benefit online. These copays would not apply to the deductible, but they would apply to your out-of-pocket maximum. So if you're interested in checking our formulary, which is the list of covered drugs, you can go to healthpartners.com/preferredRx. This way you can check to see how your medications are going to be covered by the plan, and you can verify that they are on the formulary. We also have a tool called a drug cost calculator at healthpartners.com/pharmacy, where you compare the best price based on which pharmacy you're interested in filling your prescriptions at. If you have any questions on your pharmacy benefits, your out-of-pocket costs, maybe a specialty medication, or if you just want someone to look up your medications to check if they're on the formulary, we have pharmacy navigators on staff. And Virtuel is our online 24/7 clinic. Is anyone here familiar with Virtuel? It's simple, convenient, and safe. You pay the cost of a convenience care clinic visit. So on the HSA plan, it's a $45 copay. On the two copayment plans and the $900 deductible plan, it is actually covered at 100%. Treats over 40 common conditions, for example, pink eye, bladder infection, sinus infection, and over 98% of our customers highly recommend. Plan for Me. We also have a tool available to members called Plan for Me that compares plan costs, prescriptions, doctor's options, and more. Gives you convenient 24/7 online access. You would go to healthpartners.com/plan-for-me. You can type in the medications you're taking, your plan premium, your plan deductible, and compare the plan options.
All right, so just to reiterate a couple of things, on your chairs, you should have a green sheet of paper that looks like this. That is a summary of the plans side by side. One side is in-network, one side is out-of-network, as well as Health Partners' more detailed, medical book, which will go through, again, the plans in more detail, as well as all the tools and resources that Health Partners offers. Katie kind of went through the plans. Again, what we tried to do with the 3 plans that are currently in place is mimic exactly how they are today at Blue Cross Blue Shield. Of course, the list will differ when you switch vendors. That always is a difference, as well as the providers, particularly those providers which are in Tier 1 and those providers which are in Tier 2. So you'll want to take a look at that on Health Partners' website. The last plan, the new one, the new option, I'll go into a little bit more detail now about the health savings account. Katie talked about the insurance feature of that, what you pay your premium for, and then there's a savings feature. But we do want to remind you that all of the plans, the deductibles and the out-of-pockets renew on the calendar year. Again, preventative coverage is always covered at 100%, whether you're on the health savings plan, compatible plan, or on the copay plan. So if you go in, get your wellness visit, you shouldn't have to pay a copay unless there's something else that comes up during your visit in which is not considered preventive care. Dental, you still will have your 2 dental cleanings on your, associated with your medical plan, so keep that in mind. And then Katie will go over the voluntary dental plan as well. So to talk about the health savings account. A health savings account essentially, as we said, works with the IRS states that you can only open a health savings account if you have a qualified high deductible plan. So the plan that we put in place, the $2,600 plan, is a qualified high deductible plan. All services that Katie mentioned go towards that deductible except for preventive care, as well as they have the opportunity to have preventive prescriptions. But if it's not a preventive prescription, just to give you an idea, what's going to happen is you'll go into the pharmacy or the doctor, show your ID card so they can run it through Health Partners system and apply discounts, but you will be charged for the cost of that service. At the pharmacy, you would have to pay at the point of service, and at the doctor's, they would then bill you. And again, we'll talk about how you then pay that through your health savings account. The health savings account helps you pay for those expenses. You have the opportunity, and your employer has the opportunity, to set money aside for you in a separate savings account. Washington County has partnered with Wells Fargo to offer this for employees. Money would go in, you decide how much you'd like to put into the health savings account, similar to your flexible spending account, and it would go in each and every payroll period on a pre-tax basis. So the advantage is that you own a health savings account. As soon as that money goes in there, whether it be from you or your employer, it's yours to keep forever. Okay? You can use it always to pay off qualified medical expenses, whether it be through this plan, such as costs that go towards a deductible or co-pays, etc. It is always going to be tax favored, meaning you won't pay taxes on that money as it goes in or as you pay for qualified medical expenses. So you also have the opportunity to roll over the money you put into the plan from year to year. Okay, so it acts again as a savings feature. When you reach retirement, what happens is if you're age 65, you can actually take that money out for any reason, subject to current taxes. Prior to retirement or prior to age 65, that money would be, if you took it out and paid for a new TV, you would be subject to a 20% penalty tax as well as current income taxes. So, but at age 65, it gives you the flexibility to use it for other things as well. Now, in order to open a health savings account, you are to contribute to it or to have your employer contribute to it. Again, you have to be enrolled in a high deductible, qualified high deductible health plan, such as the $2,600. So if you're on the $900 plan or you're on the $25 copay plan, you are not eligible to open a health savings account. In addition, like I said, the health savings piece of this is not a health plan. It is your individual savings plan. So you and you alone are responsible to know if you're eligible to have one. First part, again, you would be enrolled here at the county on the $2,600 deductible. But you also have to be aware that you cannot be enrolled in any other health plan. So if you are double covered, say you're on your spouse's plan, that would not allow you to make contributions or have contributions made to a health savings account. It would disqualify you, whether it be on their health plan or on your spouse's flexible spending account. Okay? So the flexible spending account in and of itself is another pre-tax vehicle, which is a health plan, and disqualifies you from contributing to a health savings plan. So you need to be aware of that. You also cannot be on Medicare, TRICARE, or receiving veterans' VA medical benefits for the last 3 months. You also cannot be claimed on someone else's taxes. So again, the county is not going to know your certain situation and the different things that go on, so it's up to you to be aware of these things. But if you are eligible to enroll, what's going to happen is you will have the opportunity, we'll talk about the county's contribution or the proposed contribution to the health savings account in a moment, but you can contribute annually if you're enrolled in the $2,600 plan at an employee-only level. You can contribute up to $3,350 for 2015. And that would be the combination of your money and the county's money. If you're enrolled in single plus spouse or single plus child or children or family, you have the opportunity to actually contribute, again, you and the county combined, up to $6,650. This amount is adjusted generally annually by the IRS, usually moves upwards $50 or $100 each and every year, and we'll let you know that as it happens. If you are age 55, you also have the opportunity to set aside an additional $1,000 for catch-up contributions to help save for retirement. So you will need to, you can see that's how much you can put away, that's the maximum, the IRS says, but you certainly don't need to put that much away. So you'll need to determine what's right for you. Just like you do with your flexible spending account, what are your expenses and so forth. Again, qualified medical expenses are going to be very similar to those under your flexible spending account. It will be copays, deductibles. It can also be eyeglasses, dental, etc. So how much you want to spend or how much you want to set aside is up to you. Now, Leanna will talk about task in the flexible spending account, but as I said, the flexible spending account, if you were enrolled in what we call a full scope, access to all reimbursements on the medical side of it, then that would disqualify you from having an HSA. So what we're doing with your flexible spending account is we're making, for those who are enrolled in the HSA, it's what's called a limited scope. Your flexible spending account, if you enroll in the flexible spending account and have the health savings account, you'd have a limited scope FSA, which would only allow you reimbursements for dental and vision expenses. And again, Leanna will go into that in more detail. So you can have both, but just know that the FSA would be limited to the dental and vision. Once you enroll in the plan, as I mentioned, you go to the doctor and you receive, you're not going to pay at point of service when you go into the clinic or you go into the hospital. They're going to send you a bill. And once you enroll in the plan, what you get is a debit card from Wells Fargo. And that debit card, you can pay at the point of service at the pharmacy, write the number on any bill, and pay off whatever balance you have, as long as the money is in the account. Again, unlike the flexible spending account where you say, I'm going to set aside $1,000 this year, and it comes out in equal installments on your throughout your pay, but you could spend the $1,000 on January 15th. In the HSA, the money needs to be in there in order to use your debit card. So keep that in mind. If you are currently a member or a member customer of Wells Fargo and you use their online services, and you'll see an account summary with their savings and your checking and whatever else you have out there, your HSA will also show up in your overall account summary. So you could access it online through your own personal banking site. Otherwise, they have several, if you're not a Wells Fargo customer, you can access wellsfargo.com, go to HSA, sign up, register, and so forth. They have mobile apps, text banking, and all sorts of the newest features out there for technology. Now, because this is a plan, or this is a savings vehicle for retirement as well, there's also an investment feature. If you have $2,000 or more in your health savings account, you can choose to invest it in an array of mutual funds offered by Wells Fargo. There's no transaction fees, no load, so you can move that money around how you see fit. And again, there's free education and guidance from investment professionals at Wells Fargo if you need that. When you go on, and again, you would log on to their website to manage your overall assets, move money around, and it's kind of just a picture of their dashboard showing you what that might look like. And then here is the list of mutual funds that they do offer. Quite extensive, ranging from money market all the way up to international growth. As a new account holder, so if you choose to go into the $2,600 deductible plan this year and to set money aside in the health savings account, you will receive, number one, your debit card in the mail, and then you'll also receive a couple of welcome emails, which will tell you how to get on the website and so forth. And then every quarter you'll receive some informational ongoing quarterly newsletters. There is a dedicated customer service team, so there's an 800 number that's available, as well as their website. And then these are just disclaimers because they offer mutual funds. I won't go through that. But what everybody is probably wondering, okay, so you talked about how much can be contributed each and every year, but what is the county proposing to put in? The county is proposing and negotiating with the unions right now. Again, at the top here, it shows the maximum that can be contributed to the health savings account, depending on the level of coverage you have in the insurance product. And the county is proposing for 2012 to put in $1,200 for employee-only employee plus spouse, or employee plus child or children, or employee plus family. Now, to encourage people, additional contribution for 2015 are proposing to of $400 for each person that enrolls in the plan. So the total would be obviously $1,600 for singles, and then it would be $2,000 for the other levels. If you choose to enroll in 2016, the county is proposing to put an additional $200 in. So they keep the $1,200 for the employee only, $1,600 for the family levels, but then put an additional $200 in. Again, this is what's being proposed and negotiated with the unions. So your maximum contribution for 2015, because you have to take into account the county's contribution, would be $1,750 for employee only, and then $4,650 for all other levels. Again, if you're age 55 or older, you may add an additional $1,000 to that. Now, the county has been very generous. They want to help people. As I said, the money needs to be in the account before you can spend it. And a lot of times that gives people a little bit of heart palpitations. Well, you know what? I know I'm going to have expenses in January. I don't know how I would pay for those expenses up front. The county, and I've only seen this done maybe one other time, is actually going to put the money in your account as soon as feasible on January 1. So if you sign up, it'll be in there on January 1. Generally what happens, and probably will happen over the course of time, is that we'll go in periodically, whether it be quarterly or each pay period. But they are going to help you get started with this account by funding it up front, and that's, again, what's proposed. If you put in the maximum in the HSA, you do need to be in the high deductible health plan for at least 12 months. Okay, so if for some reason things change, you get married, you get divorced, have a child mid-year, those are reasons in which you can switch your health plan. And that way, if you switched and chose not to be in the health savings account or the high deductible health plan, but you had already pre-funded all of the money, you would have to back that out on your taxes. So just be aware of that. It is prorated throughout the course of the year. Okay, and I'm sure there are questions, but we will wait until the end to take the questions. I did put out on the back table, when you walk out the door, 3 pieces of paper regarding the health savings account. If you are interested in it, please, you can pick those up. It's a Q&A and so forth. Katie?
All right, so you also have the option of the voluntary dental plan offered through Health Partners. For the voluntary dental plan, we also base our providers on the distinctions network. So we divide them by the size of the network and the cost. So in benefit level 1, you can see the size of the network is very small, but you also are going to have a lower cost with benefit level 1 providers. Benefit level 2, the size is much bigger, but you're going to have a higher cost using a benefit level 2 provider. Benefit level 1 includes all of the Health Partners dental clinics and all of the Park dental clinics. Benefit level 2 includes all other dental clinics that we're contracted with, so just our open access network. I won't go through the plan in detail as you have a green booklet in front of you that will list the plan benefits. But as you can see, benefit level 1, you're going to have a $1,500 annual maximum. And then for benefit level 2 and out-of-network, $1,000. So as you can see, you're going to get the better benefit by using a benefit level 1 provider. I just want to mention as well, we are also covering the white fillings on this dental plan. And we've included a benefit called Little Partners. Little Partners is 100% coverage on services done by a network dentist for children aged 12 and younger. Again, no co-insurance or deductible. Coverage includes cleanings, exams, sealants, fillings. So with your dental distinctions plan, you have 100% coverage for most preventive dental services. You also have access to discounts on some of the top orthodontic care providers within the Twin Cities, and that list will also be noted in your green booklets. Extra gum care. We also offer extra gum care for pregnant women and diabetics. That includes cleanings, exams, scalings, and root planning, and there's no deductible or co-insurance.
Just briefly, one of the other reasons when we looked at the insurance carriers out in the market was we wanted to, working with the committee, the Insurance Labor Management Committee, expand upon the wellness offerings, the WIN program here at the county. And we will be partnering, we're in discussions right now with Health Partners. They have a very robust program which we'll be trying to incorporate in and complement the current WIN program. So more to come on that and some of the features that will be available there. With that, I'll give it to Leanna from TASC.
All right, so your flexible spending account. There are two different types of flexible spending accounts. And when it comes to the money that's put into your FSA, the money is never taxed, similarly to the HSA, so therefore increasing your take-home pay. The first type of FSA is a healthcare FSA. It's the full scope healthcare FSA. Using these pre-tax dollars, they're eligible to be used towards medical, dental, and vision expenses. The annual contribution maximum is $2,500 per year, and the difference with the HSA versus the FSA is the dollars are available to you immediately on January 1st. So the amount that you elect is available for you to spend immediately at the beginning of the year. And a new feature that was added this year, which is not required by employers to do, but Washington County has elected to do this, is the carryover feature. This will roll over up to $500 of your remaining balance in your FSA account into the next plan year, so that you're not losing those dollars. Anything over $500 that's remaining in the account will be forfeited, but you are able to carry over $500. And the maximum dependent age for the FSA is 26. The second type of FSA is a dependent care FSA. This uses your pre-tax dollars for eligible dependent daycare services such as daycare centers, nannies, nursing homes, somebody who is your dependent. The funds for the FSA, for the dependent care FSA, are different than the health care FSA in terms of it is money in, money out. So the funds are only available to you once they've been contributed by each of your paychecks. Qualifications for what the money can be used for must be used for dependent care for children under 13, for an individual that regularly spends at least 8 hours per day in your home, or somebody who is physically or mentally incapable of self-care. And the maximum contribution per year for the dependent care FSA is $5,000. Like I touched on a little bit, new this year is that rollover feature, the carryover of $500 into your next plan year. If you choose to do the carryover feature and you're in the full scope FSA and in 2016 you choose to elect to do an HSA as well as an FSA, that's where you're going to be using the limited scope FSA. The limited scope FSA can only be used for vision and dental if you have an HSA. So if you have an HSA at all, you can only be using the limited scope FSA. So let's say you're in the full scope FSA in 2015 and you choose to change to the limited scope with the HSA in 2016, the funds that you roll over into the next year up to that $500 will then change to only be able to be used for those eligible expenses for vision and dental. So you won't lose the dollars, they'll just be, you can only use them for certain things that following year. And the dependent care FSA funds, however, are forfeited at the end of the year if there is any remaining balance. So how it works is similar to the HSA. It comes as a debit card. You're able to use that debit card for any of your medical, vision, or dental expenses, and it is a smart card. So depending on what you're using that card for, whether you're at the doctor's office or paying a daycare provider, that card knows where you're spending that money. The card knows which merchant you're using that card at, so it'll pull it from the correct account. So the accounts within the card themselves, there's the My Cash account and the My Benefits account. The My Cash account is for use of your dependent care funds, and the My Benefits account is for use of your health care FSA funds. So it knows exactly where to pull it from. There's no crisscross. There's no pulling funds from the wrong account. That's the benefit of having that smart debit card. And being able to just swipe it, there are no RFR forms to complete. It's really easy. You just swipe it directly at the merchant, and you're able to pay right then and there. However, the card will decline if you're swiping at a non-eligible facility. So it knows whether or not you can be using that card wherever you are. So it will decline if it's not eligible. And you can find the eligible expenses on mytask.online.com, and you can find it on our app, which I'll talk a little bit more about in a minute. For the My Cash account, that is where the dependent care funds will go. Also, any reimbursements that you have will go into that account. If you pay for any medical expenses out of pocket and you apply for a reimbursement, the funds will go into that My Cash account, and those specific funds will be available for you to use for groceries or gas or whatever it is that you want to spend it on, because you've already used your own dollars on the medical expense itself. So, and the card does know where to pull it from, so it won't pull funds from your full scope FSA or from your healthcare FSA account. And you can grab cash, those reimbursed funds. Just some details about the card. The card expires in 4 years. So if you continue to use the FSA, the card will expire after 4 years, but it will continue to replenish itself on January 1st of each year after you elect to stay in the FSA. And like I said, it'll change the features behind it. If you go from a full scope to a limited scope, or vice versa, it'll change how it works for you. So it is very smart. We do have a My Task web portal, so you go online and create your own account. You're able to access all your information on there, your account balances, any medical expenses that you've spent thus far that year. You're able to see everything online. And just reiterating that the total amount of your healthcare FSA funds are available to you on January 1st, depending on what you elect. And somebody had asked this question before at another meeting. If you choose to elect, let's say, only $500 your first year, 2015, you want to elect $500, and you don't spend any of that $500, the carryover feature will allow that to roll over in 2016. If you don't want to elect any more dollars in 2016, you can elect to just stay in the FSA and keep that $500 rolling over continuously until you decide you need it. So you don't, after your first year, when you elect a certain amount of dollars and those have been funded into the account over the course of the year, you don't have to elect any more dollars. You just have to elect to stay in it in order to keep those funds. So you can kind of use it as a safety net if you want to, just remembering that only $500 will roll over. Let's see. So if you do need to request an reimbursement for anything that you paid for out of pocket, you can do it online at taskonline.com/mytask. And the MyTask mobile app, like I mentioned before, it's really awesome. You sign in, you can see your balances. So if you're at the doctor's office and you know exactly how much the bill is, but you don't know how much is in your account, you can double check, and you know exactly how much to tell them to run the card for and pay for the rest of it if you need to. It's really, really awesome. It's easy to have it right there in your hand. You can request a reimbursement via text message also, or fax or mail. And we have some awesome customer support. Everybody's available for you 24/7 online, and there's a phone number right here for you. You can also request some support on the mobile app as well. Does anybody have any questions? Oh, we're waiting on that, I'm sorry.
Okay, lastly, the Insurance Labor Management Committee did decide this year to add a voluntary vision plan, and this plan, again, is voluntary, so it is a low-cost option to help cover some of the expenses for contacts and glasses and so forth. Do remember that you still have your preventive vision exam, which is included with your medical insurance. The voluntary vision is going to be offered through a company called iMed, and in looking at this has become more and more popular with employers to offer this as an option for employees, because eye exams can be a very important piece of your overall health. It can help to detect a number of diseases up front, such as heart disease or diabetes, glaucoma, etc. So again, very important, and want to give people the opportunity to join if you'd like to. The rates you see listed up here are rates per month. This will be deducted from your paycheck on a pre-tax basis, and it will come out in equal installments through each pay period, but this is a monthly rate. So again, pretty inexpensive. For an employee, it's only $6.50 a month, and for a full family, it's $19.11. On your chair, you also have a couple of handouts, which were paper-clipped together from iMed, give you more detail about the plan. But just to run in general, there are eye exams, again, $10 copay for that, allowed every 12 months. If you elect to get glasses, there's a frame allowance up to $150 every 24 months. Standard lenses, there's a $25 copay. You're allowed to get standard lenses every 12 months. And then different lens options will entail different types of copays. And again, more description within your packets on your chairs there. Contact lenses, there's a $150 allowance, and this is allowed every 12 months, I believe. And LASIK, if you're looking to have LASIK surgery, there are options for 15% off retail or 5% off any promotional prices. If you decide to join the vision plan, you'll get a communication in the mail, which will give you your vision cards, as well as a list of providers near your area. So they'll look at your zip code and actually print out a custom list for you of the providers within, I believe it's a 15-mile radius. Their providers, they have over 58,000 providers, 70% of them. One of the reasons we looked at really three different big vision offerings out there, and one of the reasons we chose iMed was because they have a nice mix of not only your more boutique providers, the independent providers, but also your bigger chain stores like the Pearl, Target, and so forth. So it's a nice mix. 70% of their providers are independent, 30% are going to be your bigger chains like Pearl Vision, Target Optical, and so forth. The couple of things about the plan: you can use your benefit for the purchase of any contacts or frames, and there's 40% off your second complete set pair of glasses or prescription sunglasses. And again, just to reiterate, it's 12, 12, 24. So every 12 months you are allowed an exam. Every 12 months you're allowed lenses, whether it be contacts or eyeglasses, and then frames every 24 months. And a lot of people say, well, I'd like to join, and when I join, I wear both contacts and I wear glasses, and I need both of them. So how do you get the most of your plan when you want to do that? And this kind of gives you an idea. You go in and get your eye exam for a $10 copay, and then you would use your entire allowance of the $150 to purchase a pair of contacts. Okay? And then you can pick out a frame for your glasses up to, again, $150, and then 20% off if it costs more than $150. Now, because the plan is set up for lenses or contacts in a one-year period, you'd actually pay for the cost of your lenses for your glasses, but you could get 20% off. And since your plan is set up for 24 months with frames, then next year, if you wanted to up your lenses, you could again access your $150 to replace your lenses in your current frames. So just to give you an idea how to kind of make the most of the plan. When you look at the plan in general, again, the benefits summary will have more detail, but it's not only the allowances for frames and lenses. They have discounts, again, 40% off unlimited additional pairs of glasses or contacts, 60% off discount on popular lens options, 40 to 60% off contact lens fit and follow-up, and then 20% off other items, optical-related items not covered by the plan. You can go online and actually schedule exams. They have a very interactive online tool available for you where you can look up providers, and they also have the mobile app as well, just like Health Partners does. You can actually download it to your smartphone if you need to look up providers or access your ID card and so forth. Again, this is just a screenshot of their website, very easy. Go on, you're on the Insight Network. Again, it should say that all over the paperwork you have in front of you. Enter your zip code, and it'll come up with a list of providers near your home. In addition, when you join the plan with your welcome kit, you will get a $50 coupon to go to Sunglass Hut and purchase sunglasses. So non-prescription sunglasses is just kind of a promotional item that they're doing for Washington County. And then there's customer care service, obviously, either via their website or through an 800 number. All right, that wraps it up for us today. Just a reminder, open enrollment will begin on November 3rd and run through November 17th. It'll be out on WashNet. This PowerPoint and other materials will also be posted out on WashNet for you to review. And at this time, we'd like to open it up for questions. Lawrence has a microphone back there, so if anybody has any questions. Really? There's one.